Hi everyone, I'm Dr. Faisel Sayed.
And I'm Dr. Dan McCarter.
And you're listening to Faisel and Friends, where we believe access to primary care is a right, not a privilege.
Faisel and Friends is brought to you by Primary Care for America, a diverse collaboration of innovators leading the way towards comprehensive, continuous, and coordinated primary care. Today, we're sharing two different conversations about From Inspiration to Impact, Family Medicine at the Crossroads of Change. First up, we're talking with Shawn Martin, Executive Vice President and CEO of the American Academy of Family Physicians. Let's get started.
We've got Shawn Martin with us here at the annual conference 2025 here in Kansas City. Shawn, it's good to see you again.
Gentlemen, it's good to see you. Thanks for being here.
Yeah, that's great to be here. So I know everybody knows who Shawn is, but let's make sure we get you introduced correctly. So
Tell you who I am?
What your job is. Yes.
Awesome. Well, my name is Shawn Martin. As you said, I'm the Executive Vice President and CEO of the American Academy of Family Physicians.
Wonderful. You know, since last night, I've been meeting a bunch of students and residents, and one of the things I've been hearing a lot about, the excitement, is around work life for family doctors.
Yeah.
The changes that have happened just in the last year alone. So I'd love for you to touch on that. About the conference theme is about futures. So if you wouldn't mind talking about where we are right now and what students and residents can look forward to in the next handful of years.
Handful of years. Well, I think there's a couple of things. I think one, you guys know you've lived and worked in this experience of the practice environment has become, over the last decade and a half, very untenable in many respects. And, we've taken on leadership roles of trying to identify innovations that make that practice environment more appealing, both to currently practicing physicians, but also future generations. But the second thing we've been doing is really trying to shape it to align with their values, their approach to medicine, their desires to be connected in a community and taking care of a community. And we've done that in a variety of ways. We've looked at innovations that range from Medicare-only solutions to take care of that population, to direct primary care, to engagement in community health centers. I am prone to say that there's not one solution to primary care. It's going to take a variety of solutions to meet communities. But this conference itself is just amazing. I'm always very motivated because it's a visual reminder that everything's in front of them, and they're excited about what's in front of them. And the awesome responsibility and opportunity that we have to create that future for them is just something that brings a lot of satisfaction to us and our team. But we changed the conference to future because of that statement I just made. Everything is in front of them. This is all about their future.
It's so re-energizing for me as a family doctor coming over here. You get students and residents from all over the country. So many doctor minds just in one place. And I had a resident this morning talking with me about the town she was from, how she's a trailblazer and all this, and I'm trying to just figure out where she was speaking about her town. Ultimately, she was like, "You have no idea what I'm talking about, right?" I was like, "No, I don't know." she was like, "I'm in Wisconsin," and I was like, "Oh, okay, yeah, we know." What does it feel like to be around all these young minds? You're in D.C., you're doing all this fight, and now you're here around all these students, and there's so much great energy. What does that do for you?
Yeah, well, it's infectious, right? It's unbelievable to be here. To watch. I just like to watch their enthusiasm for their careers, for family medicine, for each other, the support that they lend each other. But I think the thing that's really wonderful about this conference is a lot of times they come from campuses where, maybe there's only 5 or 6 of them that are interested in family medicine. You touch down in Kansas City and you show up at this conference, and we speak a lot about community. But they find a community of people that are just like them from all over the country, share values, share professional desires. They get to connect with people that want to do rural health or, do family medicine OB and it's just an amazing opportunity for them to find a peer support network that will just be with them the rest of their career.
Yeah. Well, and this, Faisel will talk to anybody anywhere, but most of the rest of us don't do that. But here, when you're around the hotels, it's interesting. You get on an elevator with almost anybody right now, and if you ask them already at the family medicine conference, they've got a story to tell you.
That's right.
About what brought them to family medicine, why they're here, and it's like a huge small town this one weekend every year, right?
Well, it's just incredible. There's 5,000 people here. You know, we have almost 1,600 medical students, about 1,500 family medicine residents. We have over 500 residency programs represented here. We have people that, you know, I met a gentleman yesterday, this is his 30th year at this conference as a program director. I mean, people come back. I think, you know, this conference is designed for medical students and residents, but I think the attendings come back here to get their cup filled. Like, you know, this kind of brings you back to kind of the reasons you love family medicine and you go into family medicine. But it's a really unique experience that family medicine does that other disciplines of medicine, you know, don't invest in the same way of creating these opportunities.
Right. So we were just talking to our previous guest about direct primary care.
Yeah.
And I'm just running the numbers. You said there are how many medical students and residents? Like 3,000?
Yeah, a little over 3,000 here.
Yeah. And it looks like direct primary care in an employer-based model, if they had a panel of 600 patients and you were saving $3,000 per patient per year, what's that, $180,000 a year?
Yeah.
Yeah. So if you had $180,000 a year and multiply that by 3,000, we're talking about the cost of healthcare in the U.S. going up.
Yeah.
If these people are deployed correctly, this can save. This is the solution to the healthcare cost crisis in the U.S. Right? It's not cutting stuff away from people. It's making sure they get the care they need to begin with.
That's right. And I think, you know, we've talked about this in previous, you know, podcasts. Primary care is the only, you know, solution or intervention that has been proven around the world to have the opportunity to both improve health, but also to do so at a reduced cost on a per capita basis. And I think DPC is a really, you know, microeconomic indicator of how that happens at scale. So as you just said, you break it down to the individual practice and start to see practice savings, but individual family savings. I think they have an opportunity, you know, with the new law, an opportunity to really do some unique things in communities across the country. We're really excited about it. It's not frictionless. Like, you know, I mean, there's some things that have to be addressed. You have to scale at the right pace and in the right way. But we're really excited about the opportunities DPC bring. And as you guys know from your lives in family medicine, you know, DPC is unique because it just takes away all the things doctors, you know, don't like, and all the things that prevent you from spending every minute with the other person in the room with you.
Yeah, that's one of the things I'm hearing from the students. Like, there's a lot of excitement right now around the work life of a family doctor.
Yeah.
Finally, the technology has caught up. We've got a lot of the bureaucracy has been lifted. So for students who are coming over here, what's the message that you have for them about the work-life experience? Many of them, we'll meet practicing physicians who will tell us, hey, I would have gone family medicine. I wanted to be a family doctor. I didn't end up choosing it because of the work experience. Now, a lot of those reasons that people didn't choose, they clinically wanted to do it, but because of the work experience, they shifted a different way.
Yeah.
What's your message for the student in all of us? We're just like, oh, man.
Well, there's two messages. I think one, you know, people that go into medicine tend to, I don't always use the word calling, but they tend to be drawn to this concept of service.
Yeah.
And they pursue service because they want to help people live healthier and better lives. And if that is your calling, and that is the reason you pursue medicine generally, there's really no better place than family medicine. There's just not a discipline where you get to do that across the age spectrum in any community with any population, to really have a 30-plus year or 40-plus year impact on somebody's lives. So follow that calling. If those are your values and that's your truth, follow that calling. And what I promise you is that we're going to continue to make that environment professionally satisfactory for you. We're going to make that environment fulfilling and, you know, facilitating so that you can do those things. And, you know, it's never going to be perfect. You know, you can never make a family doctor happy 100%, but we can create a better frictionless practice environment. I see AI as a tool in that. I see new payment models. I see new practice models like DPC starting to put that together. But I'm excited about the future of family medicine. I think there's just a lot of runway in front of us. There's a lot of need, and this is what individuals and patients want. Like, this is what they're seeking in healthcare, and some are trying to get it through an AI bot, and that's not going to do it. An AI bot can't hold their hand. An AI bot can't give them a hug. An AI bot can't sit in a rolly stool and hear their stories, right? Like, I just think we have a lot of opportunities to really connect with the American people and create a different experience.
Well, I got to say, from last year, I left here feeling extremely enthusiastic and energized going back to my practice and going back to life. This year in particular, I just want to thank you for all the efforts that you've done
you guys.
to lead, do all the hard work to get us to where we're at right now, where now students are excited about the work experience of a family doctor, which it took a long time to get here. Like, hey, we've got a business model. You don't have to worry about it. We've got a practice model. You can pursue your passion. I just want to thank you personally.
Thank you, Faisel. Thank you. You and Dan, I always enjoy sitting down with you. I appreciate what you guys do to give platform and give voice to people that are doing amazing things across the country in family medicine, and it's great you're here, and it's always good to see you.
Great.
Wow.
Thank you.
Thank you so much, Shawn. Thank you.
Take care.
Really, man.
Thank you, guys.
Great.
To continue the discussion, next we're talking with Dr. Tina Sharma.
Here we are with our next guest here at the annual conference. We're with Dr. Tina Sharma. Welcome.
Thank you so much. It's an absolute honor to be here. It's been an amazing experience, and I've always seen the podcast happening and hoping one day I'll be able to be here. So it's finally manifested, and I'm so excited to have be with both of y'all as well.
That's great. So just before we get too far into this, tell us a little bit about what your role is and where you're from.
Yeah, so I'm originally from Dallas, Texas, in the suburbs, Plano, Texas, and traveled quite literally the world for medical school, went abroad as an IMG, and then finally got to come back home. I actually do my residency at UT Tyler in Tyler, Texas, East Texas, and I'm chief resident. It's my final year, and all I can say is it's really a dream. I'm in the best specialty ever, at the best program ever, surrounded by the best people, and I'm really living my dream right now.
So how long have you been coming to this conference?
So I've been coming to this conference this is going to be my 4th year. So I came as a 4th-year medical student, really here bright and early, the first one at that door, just ready to come and learn from the workshops and get to introduce myself to all the different residency programs, and here back every year to now give back to the wonderful medical students, and kind of, it's a full circle for me, and I'm really excited.
So going through residency is pretty stressful, at least it used to be. I guess it still is. So what has been your one, I made the right choice moment? I mean, it might not have been easy, but once you were able to get through it, you realized, this is what I want to be doing.
Absolutely. I think a big moment for me was just recently, now being in my 3rd year. As we go through each year, we have our continuity patients. And the first few patients I had my first year, in East Texas, I have patients coming 2 hours. They drive 2 hours because we're the only central medical facilities in East Texas and Tyler. And, they're coming after not seeing a doctor for 10 to 15 years. They're scared. They have a lot of comorbidities that could have been prevented. And there's a lot of patients who are scared to come and see the doctor, and they don't have the education of what primary care really can do to help your overall longevity in life. And I remember feeling so overwhelmed those first few weeks of clinic. And just the other day, I saw one of my patients, and really one of my first few patients, and so we've been seeing each other for 2 years now. And she's been looking and feeling the best that she's ever felt since I first saw her 2 years ago. And I remember that first time I met her, I was so overwhelmed. I actually went to my program director and I said, I'm not sure, how can I help her? There's so many things, where do I start? And that's the beauty of family medicine, because you get to learn so many different aspects, not just the medical, but you learn about the social, the financial, and you really incorporate all of that into comprehensive care. And to see now that she is thriving, and she said, Dr. Sharma, if it wasn't for you, I don't think I would have been alive. And we were at that point when I first met her, and I had to hospitalize her, and it was it was heartbreaking. And she said, I thank God for you. And every single time she said, there's God and there's you. And I would have never expected that. We don't go into this field for that. We go in to help. And we say we care for our patients. And I think, throughout medical school, throughout residency, you have those tough moments. And that's fair. And we say, did we choose the right field sometimes? Because it can be very stressful. But then seeing what the past 2 years has significantly impacted her life, I know I chose the right specialty. And I'm just amazed at how much I've been able to do and grow, both as a person and as a physician. And I'm just so blessed to have this opportunity. And I thank the higher beings every single day that I was able to come into this field.
Wow. So as you're meeting the students now, so you're at the booth?
Yes.
You're meeting students. What are you telling them about your residency program, what your experience, what can they expect as an intern in the program?
As an intern in the program,
It's so scary. Remember that time?
it's frightening. I still remember.
Let's start this. At your intern year, what's the silliest order that you were so afraid to do that now you wouldn't even think twice about?
Okay, so it's a great question. One of my attendings, she actually asked me after my first inpatient rotation, Dr. Sharma, what do you now feel comfortable ordering? And I told her there are two things, Tylenol and a multivitamin. And then at the end I said, also probiotics, because once I had patients on antibiotics, she's like, you can always order that. And she laughed and she was like, you were that scared? And I still remember my upper level, my first 24-hour shift, the nurses asked me, can we give this patient a Tylenol? And I'm just overthinking all of that when we have something so simple in our pantry, easily accessible. And I'm here spending 20 minutes thinking, can I give this patient a Tylenol? And now it's my turn with the new interns that are here, and they're asking me these same questions. And, it is scary, but it's amazing that we think about it so much, and it's all because of one reason. We care.
Because we care. Yeah, I remember my Tylenol story. Do you have a Tylenol story too? Were you ever worried about Tylenol?
Oh yeah, first night on call, absolutely.
Yeah, I remember. We were med surg, and I had my good friend, and we've stayed. That's the other beautiful thing about residency is you stay friends with your residents forever. I mean, they're friends. 6 months can go by, 6 years can go by, and then you'll talk like nothing went. And the one resident I remember, it was our first night. He was on surgery, and I was on medicine, and I had an elevated liver enzyme situation with a febrile patient. I was like, what do I do? And so yeah, that resonates actually with.
Absolutely, and friends for life, truly, and colleagues for life. I have made some of the best friends in residency, and one of the best parts, especially I think about my program, is my attendings since day one have always been approachable. Yeah. And they all say, hey, even when you graduate residency, you're more than welcome to ask us questions, text us, and we'll be happy to do that. And in fact, the other day, I actually met one of my chief resident during my intern year at another conference, and she said, now you're chief resident. And then she said, by the way, let me ask the program director one quick question I have about a patient. And she's still able to do that. And that's the beauty of it. I think residency is difficult no matter where you go. It's all about that support system and being able to know that you're going to have great people around you, whether it's your colleagues, co-residents, attendings, and even just the staff. I mean, it's amazing. I always heard that you'll be at the right program. Yeah. That right program will find you. You'll find it. And I remember coming here 4 years ago and saying, man, I need to go see as many programs as I can. And at the end of the day, I'm saying, well, will I be able to find that program? And throughout the journey, it's difficult. You don't know. You're interviewing and you want to put your best foot forward. And then I just knew at the end when it came time to do the ranking list, I said, I need a place that I know where I'm going to be supported and they're going to be able to guide me and I'm going to be able to grow the most. And of course, I would like to be close to home and nothing like Tyler, because actually I used to come to Tyler a lot as a kid. In fact, the roses that have been growing outside of our house for the past 20 years are from Tyler, because Tyler's the rose capital. So it's been a full circle to be able to come back and just represent home and represent a program that truly cares, and to represent a specialty that is truly the best specialty. I know we're a little biased, but it's amazing and wonderful. And one thing that I remember very impactful for me as a student and still to this day as a physician is I was doing my rotations in Michigan, and it's getting time to apply, and my attendings are saying, which specialty are you planning to go to? And I'm just thinking through it, and I ended up saying that I think family medicine is where I'm meant to be. And my attending, who's in a different specialty, said, I don't think so. And I looked at him because I do truly trust all my attendings and their guidance, and it's very important. And he said, you need to choose a real specialty. So maybe go back and think about it, and we'll talk. But family medicine is not a real specialty. I was so disheartened because I opened up all my thoughts and feelings, and I'm trying to figure it out. And in that moment, I went on what was then Twitter, and I posted that. And I said, this is what my attending has told me, and I don't know where to go about that. And I know there's a good social media community, and that, I think that night or thereafter, over, I think 300, 400,000 interactions with that and insights, which was amazing. And then Mr. Shawn Martin replied on that.
Who's Shawn Martin?
Shawn Martin's our CEO of AFB.
I know, just doing it for the...
He's wonderful. And he says, that's not the case. And he said, Tina, family medicine is a wonderful specialty. You're not wrong for thinking what you thought. And then he and I interacted, and he said, you know, family medicine doctors, they're the quarterback of the patient care team. And that stuck with me. And I just kept thinking about it, and we talked about it. And I actually used that line in my personal statement because that really, really strung hard to me. And I agree. I mean, from the beginning of the play to the end, it's all about seeing the comprehensive picture, whether it's a football game or whether it's patient care, getting the right people on board, and then being able to adapt, because the dynamics of a football game, the dynamics of a patient care team, and the getting all of their care taken care of, you have to be able to be flexible.
Yeah.
And so that really did resonate with me. And I mean, since then I've seen him at the various conferences, and I remember I just went up to him and I said, Mr. Martin, you might not remember this, but a few years ago, you had said something that was monumental and life-changing for me, and it brought me to the best specialty ever.
Wow.
And to this day, I thank him for that.
Thank you so much for sharing that story and your testimony.
Absolutely.
You're saying it's an honor for us to be able to learn from young doctors like you. Very inspirational.
Thank you both for inspiring us. We're always excited. I think we were talking earlier that this conference has so much energy, and the energy is different. We're all here to learn and learn from each other. It doesn't matter necessarily for medical students or residents or attendings. We all have something to share with one another and learn. And I'm so excited I'm excited every year to be here, and I can't wait to hopefully come back again next year.
Oh, you will. You'll be coming back as an attending. I can't wait.
Okay.
Well, thank you so much.
Of course, absolutely. Thank you guys for this opportunity.
Absolutely. What are your thoughts on From Inspiration to Impact? Family Medicine at the Crossroads of Change. You've heard ours. Now we want to hear yours.
Email us at faiselandfriends@gmail.com, and your question could be featured on the podcast.
If you like this episode, leave us a review and tell us how we're doing. And don't forget to subscribe wherever you listen to podcasts so you never miss an episode.
Connect with us on social media by following Faisel and Friends.
And follow Primary Care for America on LinkedIn and Twitter.
I'm Dr. Faisel.
And I'm Dr. Dan.
And thanks for listening. This podcast is brought to you by Primary Care for America Collaborative and produced by Split Prism Productions.